And then we'll talk about the skull. We're going to be talking about this for a while because there's a lot of bones in the skull. I'll probably be able to bring it. I didn't bring it today, but I do have an actual real bone skull. I do have the vertebra, and we can start passing these around. Put it into two different parts. Since I'm going to be passing this around, I'll just tell you a little bit about it so you'll know. So this is the upper cervical, the atlas, axis, and C3. Right, so this would be right here. And then these are the rest of the other lower cervical vertebrae here. And then this is going to be all the rest of the... This is thoracic and starting to get in towards the lumbar. These are going to be thoracic vertebrae with the long pointed spinous process. And then this is going to be the lumbar and the sacrum. Okay? So we'll pass these around and just be careful because it's...
Are they plastic?
Yeah.
Real?
This is the real deal. If you don't want to touch real bones, just have somebody pass it around. Pass it around you. But yeah, these are the real deal. Because when you see those, you can get a sense of that how they're light and at the same time they're strong. It's different than playing around with one of these plastic ones. So basically, you divide the skull into two different parts. You have the cranium, which is what encloses the brain, and then you have the facial bones. So the cranium protects the brain, and it's a site for attachment of muscles. And then the facial bones comprise the framework of the face, and then houses the sense organs and the teeth. And then it's going to provide openings for the oral cavity, the air, and food. And then also you have muscles of facial expression that are going to be on the facial bones. So now we're talking about the cranium. It's going to be 8 bones. 2 of them are paired and 4 are going to be unpaired. So you have the 2 parietal bones. Which are going to be here. Okay. We're going to be showing pictures of each one as we go. So then you have the 2 temporal bones. This is in here. And on the temporal bone, there's 4 different regions of it. And so those are the ones that are paired. You have 2 parietals and 2 temporals. Then you can have the frontal, the occiput, the sphenoid, and the ethmoid are more deep inside of the skull. And those are going to be thin bones that are strong for their weight. So here is the parietal, here's the temporal, there's the frontal, and then the occipital. So there's going to be 4 different sutures with the parietal bone. We talked before, you have the coronal suture, which is like the frontal plane. So that separates the parietal from the frontal. And then you have the sagittal suture, which is where they meet down the middle. So that's going to be right here. And then you have the lambdoid suture in the back here, where it meets with the occiput bone. And then you have the squamous, which is going to be here, where it meets with the temporal bone. And then, like I say, there's different parts of the temporal bone. You have the squamous part which is this flat, thin portion. Then you have the, I think those arrows are shifted. That one should go over to here. Okay, and then the tympanic here is related to where the eardrum is, and the tympanic membrane. And then the mastoid process here. And then the petrous is going to be in here. Okay. And so then there's some markings that you're going to want to be aware of on there. You have the external auditory meatus, which is where the opening for the ear. Mastoid process, that's something that you're going to need to know for palpation. Okay, so yeah, anytime like in these notes here, like I say, you have to look for the little picture of the thumb, and then anything that's underlined is what you have to make sure you need to know for palpation. I do have another handout that has all of these, but I'm just going to go through this again to make sure everything's correct on it, and then we'll have that probably for next week. That's all in the notes. So again, here's some more pictures of the, now we're talking about the temporal bone. Yeah. So then there's the external auditory meatus and the mastoid process. This is going to be part of the zygomatic arch, which is coming over here. There's another bone we'll talk about, the zygomatic bone part of the face. But this is where it's basically your cheekbone, but it's a couple different bones here. But the temporal bone starts at the beginning of the zygomatic arch. So now we're talking about the occipital bone, and that's the base of the skull. This is where the actual spinal cord passes through. There's the foramen magnum. Obviously, you're not going to be able to palpate that, but that's this one right here. Okay. So the occipital bone is making most of the base of the skull and the backside here. And then there's a lot of attachments of muscles up in here. And then a lot of the points back here are gallbladder.
Yes.
UV.
UV and water.
UV and TV. Okay. Okay, so the main thing that is these superior nuchal line and inferior nuchal line. Those are things that we'll probably go over with palpation because those are muscle insertions. Then the sphenoid bone is inside of the skull. That's going to be this part in here. Has these greater wings and lesser wings. The wings are these parts in here. Looks like it's kind of a big butterfly or a bat. And it also forms this part on the outside here, which is just anterior to the temporal bone. So it has body, greater wings, lesser wings, and pterygoid processes. And actually, it pretty much articulates with all the other cranial bones, at least the ones cranial as opposed to the facial bones. So like I say there's the part of it here. So it's in the center, and then these two parts here are the ones back in there. When we talk about muscles of mastication, those are the pterygoid plates where the pterygoid muscles will attach to. There's another picture of sphenoid. And this has also the sella turcica, which is this thing right here where your pituitary gland sits.